Welcome everyone to one of our Dean's Grand Rounds series. This special webinar hosted by the New York City Pandemic Response Institute and in partnership with the Center for Immigrant, Refugee, and Global Health at the CUNY Graduate School of Public Health and Health Policy. We welcome you. We have an invited list of panelists and experts that will make this webinar very informative, very real life, and truly, truly valuable. As you already know, the public health and healthcare workforce is shrinking. Nationally, an estimate of almost 100,000 new hires are needed in order for state and local health departments to continue providing core public health services. New York State and many other jurisdictions have grappled with a shortage of nursing and other healthcare professions since 2021. Many of the 100,000 migrants and asylum seekers who are coming to our state and our city have arrived and countless more arriving in other cities and states around the country who are trained professionals in their country of origin. This webinar will examine the opportunities presented by this flow of migrants and asylum seekers to address workforce shortages in the health system. Panelists will provide an overview of the migrant and asylum seeker experience, the challenges that they are facing, and the government and civic response to these challenges. Then we hope the panelists will present global, national, and local case studies illustrating effective approaches to engaging migrants and asylum seekers in the healthcare workforce. Panelists will speak on strategies ranging from adapting legislation to leveraging employment and other strategies that empower migrants and asylum seekers to find gainful and valuable employment in our community. This webinar is hosted in English and, as you have heard, Spanish as well by the New York City Pandemic Response Institute in partnership with the Center for Immigrant, Refugee, and Global Health. Please allow me to introduce to you our panelists today. The first is Rishi Sood. He is the Executive Director of Healthcare Access and Policy at the New York City Department of Health and Mental Hygiene. He's also an adjunct lecturer of health policy and management at the CUNY School of Public Health and a great friend of the Center for Immigrant, Refugee, and Global Health. Rishi's work focuses on ensuring and improving healthcare access, advancing health equity, and improving the quality of healthcare in New York City. Welcome, Rishi. I'm always delighted to see you. Felipe de la Hoz is a contributing member of the New York Daily News editorial board, a lecturer at the NYU College of Arts and Sciences, a co-founder of the immigration policy newsletter, Border/Lines, and writes regularly for a variety of local, national outlets about immigration, politics, and policy. He is the author of the Center for Urban Futures, Preparing Today's Asylum Seekers to Be Tomorrow's Workforce Report. Felipe, you are welcome today to this panel. Abigail Sieve is the Vice President of Programs at Upwardly Global, where she oversees the programs team, which encompasses direct service, employer engagement, product services, and special projects. Within 15 years of experience, leading refugee resettlement and programming to support immigrants and refugee communities. Abigail brings a wealth of expertise and a deep commitment to this work. Prior to working at Upwardly Global, she served as the Executive Director for the International Rescue Committee, IRC, in New York, and New Jersey for nearly a decade. Abigail established crucial strategic partnerships with government agencies, community-based organizations, and corporations. Dr. Yasmin Slutjes is an associate director with MPI Europe, where she works on migrant health, labor market integration, labor mobility, migrants' access to services, irregular migration, and evidence-informed policymaking. Prior to joining MPI Europe, Yasmin was the executive director of the Berkeley Interdisciplinary Migration Initiatives at University of California, Berkeley. Welcome to both of you, Abigail and Yasmin. Venus Inés founded Dia de la Mujer Latina, DML, in 1997 as a national nonprofit organization that celebrates its signature health fiestas in 40 states. Puerto Rico and the Dominican Republic, provides the medically underserved Latina community with culturally and linguistically proficient health education and early detection screening for chronic disease, and provides culturally tailored preventive programs for Latino teens and patient-centered navigation. Venus has trained more than 3,000 promotores and community health workers in Texas alone, and is a state-certified instructor of community health worker training, with DML being the first approved bilingual Texas state-sponsored certification training program. Welcome to you all, and I'm very excited that you are joining us today. As you well know, 118,000 migrants and asylum seekers have passed through New York City touch points. Over 60,000 are still in shelter care. The right to shelter has been suspended at the city and state level in the midst of a pre-existing housing crisis, meaning many individuals will become unhoused in the next month. And the Legal Aid Society estimates that over 1,500 migrants arriving each week, with about 600 asylum seekers passing through the arrival center weekly. The migrant arrivals, as you know, is coinciding with a major healthcare workforce shortage, including nurses and home health aides, with a growing need for culturally and linguistically relevant service providers. Rishi, why don't you tell us more about the public health needs and response to this challenging, but hopefully very promising new chapter in our city, and what the Department of Health is, how the Department of Health is responding, and what your personal thoughts are about this new challenge.
Thank you very much, Dean, for the introduction and for the opportunity to be here. And thanks to all of you for taking the time to be on today to discuss this very important topic. I'll ask for the slides. Okay, great. Thank you. So I am, as the Dean said, I work at the New York City Health Department and am pleased to talk with you all about the public health needs and the public health response in particular for newly arrived migrants, many of whom are asylum seekers, over the course in particular over the last year and a half. Next slide, please. The objectives of the few minutes of my overview on this topic today to begin with are threefold. First is to understand the current scope and characteristics of this particular population in New York City, our newest New Yorkers. The second is to review the existing support structure that's been put in place, not just by New York City government, including the New York City Health Department, but also our partners outside of government. And finally, and perhaps most importantly, for all to consider the future needs of this population, not just in the short term, but also in the medium and long term, both from a health standpoint, but also from a health workforce and from a broader standpoint, as I think we'll hear from a number of my co-panelists. Next slide, please. So to begin with an overview, and these numbers are constantly changing, and the circumstances around this are also changing, and so these numbers are that I'm referencing here are relevant as of earlier this month. Over 130,000 people have arrived to New York City since the spring of 2022, who are recent arrivals to the city, many of whom, or most of whom, have crossed the southern U.S. border. And importantly, several thousand individuals continue to arrive in the city each week. As the Dean noted, more than 65,000 people are currently living in the city's housing, and we'll go into what that looks like a little bit. And I think really important to note that there has been little to no coordination of service provisions prior to that arrival in New York City. I think a lot of us are familiar with some of the coverage around this issue over the course of the last year and a half about buses that have been coming from states in the southern United States to New York City. I think the important point here, particularly from a health standpoint, is that lack of coordination and that lack of service provisions in other states has really led to increased needs and pent-up demand, particularly in the first few days and weeks that individuals are arriving to New York City, and that coordination is something the city is really has been providing and is looking to provide on an ongoing basis. So, who are the newest New Yorkers? The Spanish is certainly the most common primary language among this population, but many other languages are spoken. This is really a mix of people who are single adults, adult families, or families with young children, who then, of course, understandably have different types of needs. They have endured long and often potentially traumatic journeys, and this means that there are some acute health needs, some physical health needs, and importantly, because of the trauma, some mental health needs. And finally, and related to the service provisions and the need for basic services like housing and legal services as well, many, if not most, of the individuals who are arriving do not have family or support networks in New York City or in the New York City area. And thus, they do need the shelter system and resources that both the city and community-based organizations are providing. Next slide, please. So what does the current process look like for many of the individuals who have arrived or who are arriving this week, for example, in New York City? This has evolved over the course of the last several months and year plus, but currently the vast majority of individuals are coming to the arrival center or are coming to another point within the New York City area, but then being routed to the arrival center, which is in Midtown Manhattan at the Roosevelt Hotel. And there, particularly from a health and a housing standpoint, they're receiving a very quick symptom screening. They're being offered certain immunizations as well, and being asked about whether they have received certain immunizations in their country of origin or at the US border. And they're also importantly having a quick questionnaire on connections to the community, what their goals are in terms of where they want to be and housing options. If they do need housing options, there is now a complicated network of housing options being run by different New York City agencies, which are listed here. There's, of course, our longstanding Department of Homeless Services system, and there are sanctuary or emergency shelters that have been stood up, hundreds of those. There are also humanitarian emergency response and relief centers that are being run by other agencies, respite centers, which are really meant for shorter term stays. And then finally, there are a number of people who are noting that they are here in New York City, but perhaps in transit, and they're looking to go to a location outside of New York City, in part because they have family or friends there. And so there's assistance provided in terms of reticketing those individuals outside of New York City. Next slide, please. I mentioned the housing landscape at a very high level. I think really important to note that there's over 200 different housing sites and emergency housing sites that have been stood up in the last year and a half, again, being run by these different agencies that you see on this slide. And there are also additional places where individuals are offered assistance and can go to get assistance, including a center that has been set up this year to help people who seek to apply for asylum, called the Asylum Application Help Center, which is on the west side of Manhattan, which was formerly known as the Navigation Center, which was intended to be a one-stop shop, one-stop place for people to receive services, whether housing, legal, health, or other services. There are also many community-based organizations that are now serving as resource centers for asylum seekers and migrants across the city, not just in Manhattan. And this is all being coordinated at the city level through our Mayor's Office of Asylum Seeker Operations, which is a new office. Next slide, please. So now focusing on the public health concerns, if you haven't seen this, I would encourage everybody to take a look at a letter that our New York City Health Commissioner released earlier this year to healthcare providers and others who are seeking to assist this population or caring for this population. It's called a Dear Colleague letter that really goes through, and I won't read through all the topic areas that are here on this slide, but goes through a range of topics and considerations that healthcare providers, community-based organizations, public health officials, others should consider when assisting this population. And it's from basic things like immunizations that many of us might take for granted to health insurance eligibility, and really sharing information about what certain individuals, depending on their immigration status at the time, may be eligible for. Health insurance is a particularly important one because while it doesn't guarantee access to care, it can certainly help to facilitate it. And we want to make sure that we're doing everything we can to enroll every individual who's eligible into health insurance. But as you see here, there's a range of other services that we want healthcare providers and others to be thinking about. Often there are unique scenarios that providers who may not have treated this population in the past may not be on top of mind for them. And I want to highlight again the mental health concerns and the potentially traumatic journeys, because that really is such an important element of how we need to be thinking about caring for this population. Next slide, please. I want to talk a little bit more about what the city health department at the local level is doing, and this is absolutely not an exhaustive list of the public health response, but these are sort of some of the areas where we've been focused over the last year. One of the most important areas that I started to mention is around connections to care, in part through health insurance enrollment. But the health insurance enrollment is really just the first step. We want to make sure that everybody has a primary care home and that everybody has a place to go for basic healthcare services. And so we're doing a lot of work to help individuals who are new to New York navigate the healthcare system, and in many cases making appointments at whether it's our public hospital system, at federally qualified health centers, or at other providers. We also have a very specific focus on immunizations, particularly school required immunizations for children, and recognizing that this is time sensitive, not just because of the public health need, but also because they are, of course, we want all children in school. There's a lot of work going on around mental health support and providing psychological first aid and, where necessary, crisis counseling, and then certainly a lot around tuberculosis where necessary as well, including our what is often our basic and important public health work of contact investigations and being in touch with healthcare providers in providing clinical guidance. Next slide, please. So I want to just wrap up quickly with 2 slides focused on resources. I want to encourage everybody to go to this website, the New York City website focused on resources for asylum seekers. What you'll find here is resources directly for asylum seekers and migrants, but also a lot of good resources for community-based organizations and other partners in government and outside who are looking to help this population. It's updated frequently and has a lot of links to different resources and information for if you're looking to assist this population. Next slide, please. And then finally, I'd like to frame this, including the health needs, really in the broader context of everybody really looking to think about what these future needs are going to be. There are absolutely current needs, but in assisting migrants and recent arrivals to New York City, we want to think not just about health, but we want to think about the very important legal services support that's necessary. In particular, for example, if you were looking to apply for asylum, of course, housing is such an important element to this and often a prerequisite to health and connections into the healthcare system. And then finally, I want to highlight the connections to primary care and the mental health needs, and something that is not just a role for the health department, but for all of you to think about as well, how we could partner to assist this population to be connected into ongoing care. I'll stop there for now and look forward to the conversation. Thank you.
Thank you, Rishi, so much. You provided so much information and a lot of links that we'd be interested to examine. Please post your questions on chat. With me today is the director of the Center for Immigration, Refugee, and Global Health, distinguished lecturer at CUNY School of Public Health, my dear colleague, Dr. Kathleen Crivero, who will be helping me with the questions and moderation, and as well as the Chief Operation Officer at CUNY School of Public Health for PRI, and our Executive Director for External Relations and Government Relations, Danielle Green, as well as Elizabeth Manipu, who is also representing the Center for Immigrant and Global Health, Refugee and Global Health. I would like to invite next Felipe to talk to us about proposed workforce shortages and solutions in New York City, and looking at education, other key areas where we may not be fully prepared to receive immigrants. Felipe, you've been really engaged in this dialogue for a long time. Your advocacy and your insights are very valuable to us. And so I invite you to share some of your knowledge and perhaps stimulate a conversation around these important topics.
Thank you so much, Dean, and it's great to be here with everyone for an important conversation. I have a couple of slides, I think, that are just sort of mainly for help following along that maybe we can put up, but I'll start by saying that this has been an issue with a very multifaceted issue. And as was mentioned earlier, I did a report with the Center for an Urban Future that was trying to examine kind of more broadly on the workforce development side of things, kind of how we get from point A, which is sort of all these folks that are here that are looking very much to work, both in the healthcare sector and every other sector where there is work, and them actually being able to sort of enter the workforce and participate in the workforce in the way that would kind of solve a lot of the issues here, right? People are in shelter in part because, it's very difficult to find housing if you can't work. And so I want to just start off by talking about some of the issues that came about that sort of were raised during this process of preparing this report around actually training the folks and getting them ready to participate in the workforce, both from some agencies that I discussed with, and a lot of kind of nonprofit providers and other agencies, unions that were kind of trying to do some of this work. A lot of you may already know this, but there is actually a statutory prohibition on folks being able to sort of work if they're recent asylum seekers. Specifically, they cannot receive formal work authorization until 180 days after they have tendered an asylum application, which in itself can be months after they've already entered the country. And because of bureaucratic delays, it often ends up being months after even that. And so people are put in kind of a difficult situation here where they have to choose between working unlawfully, which could in theory impact their status, and just waiting until they're able to kind of work legally. And then additionally to that, there are, and I think some of my other esteemed panelists will get into this, some kind of credentialing issues around, for example, folks that already have experience and training working in the healthcare sector might not have the credentialing to do so here because, it's just sort of a separate credentialing process, and we're going to talk a little bit about that more later. I would say there's a funding issue that was raised. The philanthropic giving and foundation giving has receded a little bit in general across the last several years. Recently it has sort of accelerated, and what I heard from a lot of providers of workforce services and English as a second language services is that they can have funding issues that also are related to kind of the way the contracts sometimes are structured. The city has been known to sometimes be late in sort of actually dispersing the funds that are agreed to in certain contracts with nonprofit providers. So as with kind of almost any type of service provision, there more funding generally means more people can be served. And then there's just sort of a logistical issue that regardless of the funding that these groups might have, there are issues related, for example, to space. So I heard from multiple organizations that they just don't have the physical space to conduct very large classes. Some classes can be done remotely, such as English as a second language, but then there are classes like culinary basics or anything that would be related to sort of healthcare provision, generally needs to be in person. And so there is a space issue. There are issues, for example, with language. So I have some examples from the report. The Queens Public Library said that they have 1,000 people on their ESOL, their English as a second language waiting list for the past 6 months, right? And so, that kind of the language facilitation aspect of it is very key. And, if and until folks can sort of, learn to speak English at a professional level, it's very difficult to enter the workforce. And the training itself is made more difficult given that, you would need to have instructors that can speak Spanish, can speak, Wolof and Quechua and, sort of just the many, many things that are, the many languages that are kind of emerging, as Rishi alluded to a little bit earlier. If we could go to the next slide, please. So, I want to kind of sort of establish this by saying that, I don't view this, and I don't think the report tries to argue this, is that this isn't a pure numbers issue, that there is kind of this disconnect between folks arriving and the ability to sort of enter the workforce. The city itself lost about 500,000 residents to outmigration during COVID, not all of whom have come back. There is a workforce need. There are industries that saw a dip, such as the culinary industry during the pandemic, but have rebounded. Construction is very strong, and as we'll be talking about in this presentation, there's a lot of need in the healthcare sector, nursing and other types of professions. And the city definitely has seen actually larger influxes of immigrants than it is seeing now. So during the heyday of the sort of Ellis Island era, you could be seeing 10,000 people on some days a day, right? That was kind of the peak of things. And now we're seeing that, maybe like every couple of weeks or even over a month. So it's sort of more so of a policy issue and a funding issue. And, obviously the administration has been, the Adams administration has been clear that they're seeking more federal funding for all of this, than it is really kind of just a raw issue of numbers, right? The numbers aren't sort of overwhelming. So how do we actually allow people to sort of enter the workforce? If we could go to the next slide. So I just want to briefly then kind of go through what the recommendations were that we sort of, were able to synthesize from all these conversations with providers, with, agencies, that we believe could actually sort of pave the way towards, folks that are arriving having the ability to really enter the workforce in an efficient manner. The first thing is that really, the English language piece, sometimes gets discussed as a secondary aspect of things, but really is very, very crucial, in part because the trainings themselves and certifications and all sorts of other stepping stones to getting that job really do require some level of English proficiency. And so really expanding, investments into, both English language classes and then training that is dual language, we believe would actually, is sort of a crucial precursor almost to having sort of an effective system. One thing as well is that a lot of programs are structured in a way that requires work authorization for participation in the program itself. And so this doesn't make a lot of sense when, there are folks that are kind of, spending months or a year even, or over a year, sort of in this sort of limbo, when they could be receiving the tools that they need during that sort of like intermediate period, to be able to very quickly join the workforce as soon as they do receive that work authorization. And so having a focus on folks that are not able to work currently, but that will be able to work, is a relatively minor bureaucratic switch, but that would make we believe a very significant difference in the ability to actually kind of move people efficiently through the system. One thing we heard a lot from providers was the notion that, the pandemic obviously saw a lot of, classes, a lot of, contracts that were allowing for flexibility. So virtual classes, even some hybrid classes, and some of the contracts have sort of tilted back in the direction of, requiring in-person attendance. Obviously, for certain types of training, that's necessary and appropriate, but not for everything. And so, I remember one program director that I spoke to mentioned that they had a program, one cohort that went from being kind of all in person to virtual. So the same people, really, very good experiment to test this theory. And that once they were able to go remote, the participation shot up, in part because people have healthcare obligations, various other types of things that really make the flexibility of remote instruction rather crucial. This is a really important point, and I think Rishi alluded to this a little bit, which is that it isn't really enough to target these folks with kind of just one type of service, right? So if what we want is for folks to be able to enter the workforce, that isn't going to happen if they are unable to get housing, if they're unable to get healthcare. And so, programs that actually have kind of multiple services in one, wraparound services, as they're often called, right, where people will receive even counseling, right? As we discussed, people have a lot of trauma associated with their experiences, that have, counseling, that have, housing, social services to try to find, places to stay outside of the shelter system, that have, an English language learning component, that have various other types of supports, also to help folks kind of navigate systems that they're very unfamiliar with, really have a much greater return on investment than sort of pure sort of certification or pure workforce development that sort of ignores, I guess, the kind of underlying realities that folks are living through. And I did hear this, all the time, that people would come in and say, I would love to take, this class or try to kind of recertify myself for this professional exploit, but I don't know how to receive, insurance and all these types of things. So that was really kind of an important plank for our findings. And then lastly, I think there is a turn towards certain industries among funders, we heard, that are seen as higher paying, that are growth industries. There's green energy. There are a few other. One program even wanted to train people to work in the cannabis industry because that's sort of seen as a growth sector, and that all is good to have that sort of a forward momentum. However, there are a lot of kind of existing labor needs, or in the culinary sector, in healthcare, that have yet to really be filled. And so, one of our sort of final recommendation was just to sort of try to, make sure that those aren't being sort of left behind, to kind of, maintain the traditional pathways and pipelines. And so, it's quite New York City specific, and we'll be talking a little bit, I guess, more about sort of global trends, but, is sort of kind of an overview, just very briefly, about some of the obstacles towards sort of having folks enter the labor force effectively, and a few things that we could maybe target specifically to facilitate that process. I'm sure we can also put the full report up on the in the chat as well, because I forgot to put a link up here. But with that, I'll leave it so we can get to the next panels.
Felipe, this was very inspired. You're already answering some of the questions that I'm seeing on the chat. So I don't know whether you looked at those or whether you just anticipated things that would be important to the audience. So I thank you. I will invite Abigail at this point to provide us an overview of Upwardly Global's work and share with us potential solutions that we see for meeting the needs of the newcomers to the United States and obviously New York City specifically. Abigail, please share.
Thank you so much. And I think we can go to my slides. Perfect. Really happy to be here and with such incredible colleagues. And real thanks to CUNY for bringing us all together and for this invitation. I have so much I feel like I could say after Felipe's presentation, but hopefully we'll get to some of that also through Q&A. I feel like he provided such a great foundation for hopefully some things I can build upon over these next minutes or so. Again, my name is Avi Ziv. I'm the Vice President of Programs at Upwardly Global. And I first want to spend a little bit of time sharing on who Upwardly Global is for those of you who are not familiar, and then how we've been thinking about supporting efforts with asylum seekers and migrants in New York City, particularly as they enter the workforce. And I think we can go to the next slide. So to start off, I just want to talk a little bit about Upwardly Global. We are a national nonprofit organization with an office here in New York City for many years, and we've been operational for the past 20 years. Our mission is really centered around working with refugee and immigrant newcomers who come to the US with skills and degrees and professional experience, and working to remove employment barriers that will get them into skill-aligned and experience-aligned work. I think we have all encountered individuals in these circumstances. It's the Uber driver who might have been an engineer in their home country, or an IT specialist who's working at a coffee shop. And I think it's really important what Felipe mentioned just before I started around, the varying roles that exist in the spectrum of employment. And I'm not saying at all that those positions are not employment pathways, but wanting to make sure that those, again, that come with this kind of experience aren't starting from zero when they come here. And just knowing that if we want to really build economic resiliency in our communities, we need to invest in integrating the talent of refugees and immigrants across the spectrum of their experiences, skills into the workforce. If you go to the next slide, I just want to highlight some of the impacts we've had over the past 20 years. And again, I think really just emphasize this idea that if you're putting refugees and immigrants into employment and into thriving wage jobs, it does not just help them, it helps their families and loved ones, helps their communities, and really has greater economic impacts as well that I think are just really important for us to be considering and thinking about. And so all those newcomers to New York City, I think there's opportunity as they enter the workforce. If we want to go to the next slide, I want to just talk a little bit about how we kind of get to these impacts and a little bit about our programming. So maybe the meat and the heart of the matter. So we do our work across 3 pillars. The first is our one-on-one coaching program, and that's really what we've been doing for the past 20 years and have really innovated through that, tested things, piloted, and seen what worked and has not worked, and really, I feel like, have landed on something that's really successful. It's a model that pairs refugee and immigrant job seekers with an Upwardly Global coach who works with them to do personalized career planning, connects them with resources that make them competitive candidates in the job market and the labor market. And that can include, as Felipe had noted, credentialing or skilling or upskilling opportunities. I think maybe just to say about the credentialing, I think it varies so much from industry to industry. Healthcare can look very different than some other industries and from state to state. We've been doing some work at Upwardly Global as well around legislation as it relates to credentialing. We just helped pass some legislation in Illinois that will give an alternative pathway to full licenses for international medical graduates, and kind of excited to see how that's going to play out. But something we also talk a lot about is, how can the skills of refugee and immigrants be recognized as well as their credentials? And in addition to what I just described as well, our coaching program uses a learning management system with online training and tools. And again, something we've been developing over years. It includes 5 industry-specific pathways and a non-industry specific pathway. It includes healthcare, engineering, business logistics. I always forget them all together. finance, I know, is one of the others. And then there are micro courses. It's all built for adult learners and also built for those to be able to do it on their phone and during the time that they have available, because many of our job seekers are working another job while they're doing some of our programming to get them onto a career pathway that is, again, more aligned to what they came with from their home country. If you want to go to the next slide, we really see our coaching model, again, as something that has really we built over these years and has success, and we want to be able to offer it to augment and work alongside other services and offerings and programming that's provided by other refugee and immigrant serving institutions. That includes community colleges or other university institutions, refugee resettlement organizations, and workforce ecosystems. We've been doing that kind of partnership for many years. And really just work with those institutions to adopt and integrate our coaching model, or to work alongside what they are already doing, the great work that they're doing and services that they're providing to help really continue that wraparound service. And also access to our learning platform for the job seekers that they serve, and really just see this as a way to broaden accessibility to our resources. We've been doing this kind of partnership model in New York State, actually, for the past few years. With funding from the Office of New Americans and partnering with 5 organizations across the state. So those upstate as well as in New York City that, again, are already working with immigrants and refugees. And we help to either provide them with capacity building if they need it, or technical assistance, and just helping them to best utilize the approach that we have and the resources that we have available. And maybe lastly, not just to mention, which is not on one of these slides, but the last pillar work we do is with employer partners. We have many employer partners of Fortune 500, Fortune 1000 companies, healthcare institutions. We have a really large partnership with New York Presbyterian, and work with them to both be a talent solution, hiring job seekers that have gone through our programs or through our partner programs, and also to do systems change, practice change. So helping their companies or institutions best understand how can we integrate refugees and immigrants into their workplaces. As it pertains to asylum seekers in New York City, again, I think we're really hoping that as we see more and more folks hopefully securing work authorization or on the path towards that, that we can, again, collaborate or augment other services around workforce that are already being leveraged, and provide our resources to, again, make sure that we are meeting all asylum seekers where they are at on their journey. And whether that's with community-based organizations or the workforce ones or otherwise, we want to make sure that we are doing our part and really committed to that, as I think so many other organizations and agencies and institutions are across New York State, to really contribute towards the solutions that need to be put together to best serve this population. And just to say, we're not looking specifically just at New York City. We're right now focusing on that, knowing just the need and demand, but how can we learn from any sort of programming and support we can do here and share that with other cities or states that we are working closely with. The last slide, I just wanted to give an opportunity, I think sometimes nice, to take a look at some of our learning resources for job seekers. So the QR codes on this next slide, you can navigate through some of the courses yourself. One is a non-industry specific course on informational interviews, and the other is on networking. And with that, I want to pass to the next presenter, but really looking forward to further conversation on this.
Thank you, Avi, very much. I have a slight reminder and a plea from our translators for our presenters to slow down just a little bit so that they can catch up with the many variable pieces of information that you are sharing with our listeners today. That takes me to Yasmin, and really we are hoping that you'll discuss some of the innovations, legislative and policy innovations and best practices that facilitate refugees and migrants to work in the health sector per se, and drawing from the innovations in the EU sparked by the displacement of Ukrainians, for example, which is a similar, although each of these situations is not exactly the same, but we wanted to glean some of your experiences and knowledge perhaps to share with us today.
Thank you so much. And I will definitely try to slow down in how I'm presenting. So I want to take you away from the US context and travel to the European context. And before getting started, I want to sketch a little bit the context. So over the past 1.5 years, the US received about 6 million displaced people from Ukraine. And this is really the highest number since the Second World War that the EU has seen numbers like this. And it's very important to understand that while at the time of the invasion of Ukraine by Russia, the EU was plagued by historical labor shortages across all skill levels, mostly in the areas of construction, healthcare, and in tech. And these labor shortages are intimately tied to Europe's aging population and the shrinking labor force. In Europe, for example, the working age population will decrease with 7 million people just by the end of this decade, so by 2030. And I have another scary statistic. Today, there are 4 working persons for each person over 65, but by 2050, that will be down to 2 working people for each person over 65. So just thinking about what that means, there will be an increased need for healthcare with such an aging population, but at the same time, a shrinking labor force. So that's really a challenge on the horizon, and it's already present today. So while the arrival of 6 million displaced people from Ukraine definitely added pressure on already stretched public services like healthcare, but also education, at the same time, it also offered a tremendous opportunity, especially potentially in terms of labor force. And we've seen a lot of innovation in this area. And there's a lot, but I will focus on 3 main promising innovations from which we may glean, hopefully, lessons that could be applied outside of Europe, but hopefully also inside of Europe for other groups of migrants and refugees. So to get started, one of the first major innovations is a legislative one. And this is the first ever and also really quite historical activation of the Temporary Protection Directive in the EU. This is a directive that provides access to what we call temporary protection status. This status provides immediate and temporary protection in the event of mass influx of displaced people from non-EU countries to the EU who are not able to return to their country of origin. And this directive existed, but it had never been used in the past. So this was really quite a historical moment. And why it is so important and relevant in this story of labor shortages, and especially in healthcare, is that not only did it reduce the pressure on, for example, asylum systems. So these 6 million people did not need to apply for asylum, they had immediate access to protection, but they had instant access to the labor market. So they could immediately work from day one. And this is a really big shift, of course. And this really promotes faster and more effective labor market integration. However, it doesn't mean that you need this separate status to allow people to easily and quickly enter the labor market. I just heard from, I think Felipe mentioned that there's a 180-day waiting period in the US. This is not quite the case in Europe. You can make this shorter. So for example, in Belgium, currently the waiting period is 4 months. And there's also a lot of conversation and experimentation to shorten this period. So to let asylum seekers or asylum applicants, while their case is being judged, to already allow them to start working. And people want to do this earlier and earlier. And this is both beneficial for, in terms of the labor market, of course, in terms of pressure on the budgets, public budgets, but also really in terms of the well-being of the people who have been displaced, because they get to work, they get to practice their profession instead of sitting somewhere in a reception center and waiting. So it's really, I think, positive all around. So this is really one big area of innovation. So moving to the second one, and I think here, just to broadly describe it, I would just call it flexibility. It's truly, I think, the scale and the speed of the displacement from Ukraine that really caused a lot of policymakers to be more flexible than they used to be with other situations of migrants coming in. And one example that I'd like to mention is, for example, in Latvia, where Ukrainian medical professionals who do not speak the Latvian language were allowed to practice in hospitals. So usually there are, you must be able to speak the language to be able to deal with your patients. And they made a very special and unique exception, and they allow them to speak Russian, which is quite a sensitive situation in that context. And how do they then ensure communication with the patients? So what they did is they match the doctors with a colleague who is able to translate for them to overcome linguistic hurdles. So yeah, we see that these more flexible approaches really helped. And this is both positive for the hosting community because they find very highly needed medical staff, but it's also really positive again for people who have been displaced, who are then able to practice and not be overqualified for their job, and also maintain their skill level and their experience. This approach could be further complemented, of course, with more targeted thematic language courses that we've seen in different areas. So there's language courses targeting dentists or targeting nurses. So this could be very efficient. And of course, also support with recognizing qualifications and efforts to shift from maybe paper recognition, so qualification recognition to skill recognition. So from paper to practice. So don't not only look at what paper does a person have, but do a practical test of what is the actual experience and skills that a person brings to the table, and make sure there's some standardized testing that can verify they have the skills to perform certain duties in the labor market. Of course, for a surgeon, that will look is much more complicated, but maybe for example, nursing, this is more practical and possible. So beyond this flexibility, there's, I think, a third area of innovation, and I would just call this using very holistic approaches. And I have a very interesting example here, and it's an example that both aim to fill labor shortages, but at the same time also aim to meet the health needs of new arrivals. And this is an example from the Netherlands, where there is the Empathia initiative. This is a consortium of multiple organizations, from a refugee agency to Psy Global, which is a organization that connects non-native mental health professionals with displaced people, and also an organization that represents Ukrainian people. And these organizations work together in this consortium to really look at this entire route into the labor market for mental health care professionals and really pinpoint all the different bottlenecks and constraints or obstacles that people face, and then really tackle them very specifically. And I'll give a few examples because some I think are quite innovative. So from the end of looking at filling labor shortages, they provide support with recognizing qualifications. Not that innovative, of course, it's something we've seen a lot, but also quite interesting. They, for example, look at, they provide support with filling in the very technical Dutch insurance forms. So also many of these mental health care professionals may not speak Dutch, but they will be able to practice as a psychologist, for example, by offering services in English or Russian or Ukrainian to other groups of people that want to receive these services in those languages. But there's certain parts of the job that are just only in Dutch. It's just required. And here, Empathia as an organization takes over that part and supports with these very technical Dutch insurance forms. And also quite interesting, they don't only look at training or recognize qualifications of the worker themselves. They also really look at the employer and the role of the employer. So they provide really elaborate training, more than what is actually required, to make these mental health care professionals more attractive to employers, to kind of go beyond the minimal requirements. And another way they try to kind of overcome potential reluctance of employers to hire these mental health care professionals from Ukraine, they offer the contract with Empathia directly. So it's as an intermediary organization, the mental health care professional have a contract with Empathia, and then the psychologist will work for the employer, so some type of healthcare clinic. And this really overcomes kind of the employer's reluctance to kind of enter into contractual obligations and not knowing, is there enough demand for psychological healthcare that's not in English, for example. And lastly, they also really work on matching Ukrainian psychologists with the healthcare institutions. So I think that's also really interesting. So this is all on the part of filling labor shortages, but that's not the only thing that this initiative did. They also really looked at how can we meet the healthcare needs of displaced people from Ukraine. So they don't only work on the supply of psychological support, but also kind of on the demand for it. And how do they do that? So they ensure that people displaced from Ukraine are aware and referred to curative and psychosocial support services. And also there's different taboos around this in different communities, so they try to battle these taboos. And they also provide specific advice to these healthcare institutions, how to make their services more culturally appropriate and a target to different groups. So a small step back about this holistic approach. It's very interesting. They don't only tackle the labor shortages, but also really leverage the cultural and linguistic capital of the new arrivals. So in this case, Ukrainian psychologists, to meet the health needs of this new group that is coming in. So I think that's quite an interesting approach. So zooming out, there's a lot of attention for this bigger topic in the EU. There's a lot of initiatives going on to fight labor shortages and also to ensure that people and new arrivals can quickly enter the labor market. And one big project that MPI Europe will be focusing on in the coming many years actually is the global strategy for skills. So this is a really big project that we'll be working on for multiple years that looks at how to tackle these labor market shortages in 3 areas: construction, healthcare, and tech. And then how labor mobility, but also displaced talent, but also other potential policy solutions could play a role in tackling those labor shortages. So stay tuned if you're interested in hearing more about that. That will be kicking off in January. Thank you so much. I look forward to the discussion.
Thank you, Yasmin. Very, very stimulating and very challenging concepts. I see already questions and answers related to tackling xenophobia, racial and ethnic targeting, and issues of that sort, which are beyond language sometimes. And I hope we will have time to discuss this. I hope that Kathleen Crivero and Elizabeth Figueroa are looking at the questions and will help me with the question answer segment. And I know Danielle is with us as well. I just wanted to take this opportunity to thank some of the people that helped organize today. I don't want to forget to thank Ainsley for the excellent work that she did to make this happen. And Kamrun Nahar, Ainsley Halban, Kamrun Nahar, many, many thanks for your efforts today. And Paulo Lelis from the School of Public Health, thank you for helping make this happen today. I want to turn to my new friend, Venus, and from the Dia de la Mujer Latina. Tell us a little more, as an organization overseeing the Promotoras program in Texas, how much of this sounds to you, and are we missing some important elements? I'm sure you're very much on the ground, so your experiences are extremely valuable to the conversation today.
Thank you. And again, it's been a pleasure to be here among all of you, my new friends. Could you please upload the slide? There you go. I don't know if you can see this, the Spanish and English version. My name is Venus Ginez, and due to my breast cancer experience and my sister's untimely death to cervical cancer, I started Dia de la Mujer Latina. It translates as a day for Latina women to come and have access to early detection screening to cancer, diabetes, HIV, and hypertension. And what has happened is, aside from all the common barriers that we know of, accessibility, affordability, we found that language and health literacy is really very, very much the key in our community. So the Texas legislature put together a mandate for anyone who goes through the training to become a promotora de salud, which is another way of saying community health worker. They go through the training regardless of their status. As long as they take a training from a certified training program, which Dia de la Mujer Latina is it was one of the first bilingual training programs in the state. Then we can submit their application for certification, and everyone gets certified with our training. What does that mean? Well, we have found that the two most significant issues regarding trust in our community is information and communication. How is the information being sent to our community or provided to our community where they can understand it? So we also see how it's being communicated. If you're up here and your level of literacy is high, then trying to speak to people, let's say on the border, about how important it is to not smoke, to go to get their annual checkups, you have to have that language, but more importantly, you have to have that person who can associate themselves with the community you're trying to serve. Many of us here have found that our promotoras are our immigrants, our migrants, those that are seeking asylum from what's going on in certain countries in Central America. We have found the promotoras to be people who have been, who are here on a WAYA program. That is the visa for people who have suffered domestic violence. We also have people who are coming here, Texas, that have visas for crimes or human trafficking. Well, we take them and we train them. And because of their lived experiences, we put a value to that lived experiences, and they are the perfect people to communicate the language of how important it is for early detection screening, not only to chronic diseases, but the whole issue that we had with the pandemic. I mean, we had it was a big joke when the translation of some of the material to our community was literal translation. They didn't take into consideration the cultural translation, how important it is to speak to our people in a way that it's culturally humble. So our organization is also not only a training program for promotoras and community health workers. We have 8 core competencies. Many of them graduate and they have been doctors and nurses and healthcare providers in their own country. And they feel so excited about being able to be back in the healthcare field. And even though they're bridging the gap, they still feel that they are making a difference, that all of their training is valuable. And so a promotora and community health worker now is a person who motivates people to come and get early detection screening. They inform the community about the available resources in their community. They navigate them from, you have cancer, now let's go to get a way to get more tests and more navigation to the follow-up care that you need and the treatment options. And then finally, the educating of promotoras and community health worker has been something that's very near and dear to my heart, because they are teaching me to be more humble and to understand their issues. And all of our training, as you can see here, is telehealth. Many of them have jobs now here as telehealth community navigators. So we have a Spanish line where many of them now have jobs and be able to talk to people about how to get to the nearest place to get their vaccine. They are also in the health fiestas, so they're in community activities and engagements. They also are wonderful, even at a big hospital like MD Anderson, to help navigate somebody who just discovered they have breast cancer. One of the biggest barriers that we have in our community is that we have all of the medication, but we don't know how the medication and all the therapies are going to act in our communities of color. So we have people who are clinical trial community navigators, getting more people to join clinical research, because that's the only way we're going to know if our communities are also going to be able to enjoy the treatment options that are available to the other. Emergency preparedness. Crucial for Hurricane Harvey. Our promotoras were instrumental in getting people to safety. That is now a career for community health workers to be involved in emergency preparedness and also emergency and disaster recovery. The other one is now we're finding, as we heard before from my wonderful speakers, is the aging population. So we now have our promotoras helping those older senior adults who are in need, who have some sort of a disability that hinder them from doing certain things. When we now have promotoras who are now in those kinds of positions, working with our community of older adults in need of this kind of service. And so, as you can see, our training is all over the country. We are training in Puerto Rico, in Dominican Republic, and in Mexico as well. Our training is in Spanish and English, and our training will get them jobs. And we will work with them to try to connect them with community organizations or research programs that need people from the community who have lived experience and can be instrumental in clinical research. So my goal now is to continue to get on the road, train more programs to use our curriculum, and then to start seeing how we can tailor our training to become more digital. So I can take my training to my colleagues in New York, and we can set this up online, but that they will come to a place where they can have conversations watching the online training, but also watching people that are speaking their language. So I am trying to bridge that gap and empower our immigrant and migrant community to look into the career of promotores and community health workers.
Thank you so much, Venus. And I will start the question answer segment of the session today by asking you a question that came from an anonymous attendee and said, can you please comment on the role that worker centers, which are primarily immigrant-serving organizations and unions, are playing or could play in addressing the workforce aspect of the crisis? There's also a question that said, how can you integrate low-skilled migrants, those who may be most in need, into the healthcare workforce? And I was going to ask you, what level of skill do you require in training your community health workers? And what kind of background do you invite in that kind of training?
The first day of training, the first thing I tell them is, all I want you to be coming to this room with your heart. We'll take care of everything else. If you come with your hearts and want to learn, we will provide you with communication skills, interpersonal skills, advocacy skills, teaching skills, organization skills, even knowledge, service coordination skills, all of that. But if you come with a heart ready to learn, you'd be surprised the miracles that we have seen. In fact, our administrator came from Mexico, and she cleaned houses for a living. And she came to our training, and she got
So you see that as a very good entry point for immigrants that are with a low skill, that you're able to provide that quality of training. I was going to ask Felipe if he had an answer to that. Again, an anonymous attendee: in the US case, immigration status is crucial in obtaining legal, gainful employment. Many asylum seekers may be forced to take on work under undocumented status for the purpose of survival, which may be compromised by their actions. And what can be done in these situations? Are there any temporary status exceptions for those being presented, like those being presented, for example, in the European case. Do you have any suggestions, Felipe?
Sure. So I'll start off by talking about some of the actual temporary programs that exist. I didn't mention them before in the interest of time, but we have basically two programs that can accelerate work authorization: temporary protected status, which requires, it requires a finding by the federal government that people cannot be returned to a certain country because of danger or other circumstances, and humanitarian parole, which is very discretionary. Although there are some formal widespread programs now to grant people parole. Now, these programs can help, but they're not a silver bullet. Neither of them leads to permanent status. They can be done concurrently with an asylum application. But something like temporary protected status, for example, also can take months to process. It's not automatic. I think was being mentioned in regards to the Europe example, where it's day one. It is not day one here. So other than that, though, the prohibitions are statutory. So it cannot be accelerated unless Congress changes the law, and it's very unlikely that that's going to happen. Now, the person asking the question is completely right that a number of people do work without the proper authorization, and that's a reality of this circumstance. Now, what can be done, I think, at the local, state, and federal level is these are individuals who are very prone to exploitation. So, for example, wage theft is something that we have seen a lot in terms of folks that don't know that for example, labor laws apply to them as well, even if they're not lawfully working. So to improve the circumstance, I think there needs to be a very concerted effort also in terms of education around employment rights and the minimum wage, and there needs to be sort of specific, which is where, for example, worker centers can come in, since that was also a question of kind of providing some of that specific education of, if you are not being paid overtime, this is what you can do. Even if you are not authorized to work, you have these rights. So I think that's also an important piece of things to mention, because of course people will be working without authorization, regardless.
I'm going to turn it over to Kathleen and see if she can address some of the questions from the participants. Kathleen, do you have a couple of questions that you'd like to address to our speakers today?
Sure. Thank you very much, Dean. I want to ask Yasmin if she thinks, some of the innovations she described were so dramatic and such perfect examples. But again, some of our participants have pointed out xenophobia and other issues that might stop things from moving forward, might stop innovative policies. So I guess my question, Yasmin, is, do you think all these innovations will go beyond Ukrainians? I mean, do you think, the waves of new Europeans coming from Africa and other places might also benefit from these innovations eventually?
Thank you so much for that question. And I think, that's something I haven't mentioned, but it kind of shows, I think, some of these innovations, what is possible when there's political will. And the political will was there. And I think a solution like the Temporary Protection Directive was not activated, for example, during the Syrian refugee crisis. If you compare them in size and speed, they are very much of different scales. But again, that's a political decision. So I think if I look at the reflections in Europe and Brussels right now, we don't expect this to be used again quickly in the future. However, some of the smaller initiatives, like what I mentioned, this Empatia initiative, or some of the local, like this flexibility with language, there's now very positive experiences with doing this and seeing, if you have a doctor and you allow them to work, even though they don't speak the language and maybe they have a foreign qualification, it actually works. There's a way to make it work, and we need these workers. So I think it's also really the labor shortages that will drive more flexibility and innovation in this area. So I think in that area, we will learn from it. In the area of the Temporary Protection Directive, not so much.
Thank you, Yasmin.
I just wanted to remind the panelists that the questions are available to you for direct answer. If you'd like to type in some answers, you can do so while we continue our conversation.
Great, thanks. The other question I would have, and perhaps to Avi and Felipe, because I think Yasmin offered some really interesting examples where language doesn't have to be a barrier. And I know, Felipe, you focused on language, as being really important, English language training. It would seem in New York City, you could have people that just speak Spanish. I mean, there would be lots of places in the workforce where they could be able to hit the ground running without having fluent English, especially if they got the kind of support that Yasmin described in filling out technical forms. So I just wondered if Avi or Felipe wanted to respond to that.
Felipe, would you like me to start and then?
Yeah, go ahead, and then I can follow. Go ahead.
Sure. Maybe how I want to maybe answer that question is one, to remember that it is not just a Spanish speaking population of asylum seekers and migrants that have arrived. It is quite diverse. But then secondly, maybe offer that I think, yes, there are likely entry-level positions or other types of positions where if you are a Spanish speaker or speak other languages, there are opportunities for you to secure employment. But important to also consider where those job seekers or clients or folks want to move on their career pathway, I think, is also something to be considered. One innovation or programs that have also existed is where employers themselves integrate English classes into their companies or otherwise, so that those employees that are there can access them, and they're paid for that time. So it's not extra and tacked on. And then if they complete certain levels of English, they can move up into other roles and types of positions. And I think that's an innovation and something that is really important to consider, I think, at workplaces, because it will continue to expand your talent pool and your workforce in those places. And this exists in a variety of different industries, like something like Tyson's Food, that is, a chicken manufacturer, has these types of programs as well. And so I think it's something to consider, but I'll pass to Felipe, who I'm sure has other ideas and things to add.
Sure, thank you for that. And it certainly is feasible in a city like New York. And in fact, I think Kamba, one of the community organizations I talked to, had some programs where they were placing Ukrainian and Russian speakers actually in, like Brighton Beach and in businesses, and where actually the primary language of conducting the business was that. And I've heard of similar things with, Mandarin and Cantonese and such. I think there's part of it is a distinction also between work where people are going to be interfacing with, sort of customers or patients or whatever. I think there are more opportunities, certainly, for example, in kind of like, back of the house or building services or construction, where you don't necessarily need to speak the language. Is a little bit more difficult if you're talking about folks, that would have kind of a frontline role in a healthcare setting, or even like a food service setting or something, because you sort of need to be able to also then communicate with kind of customers and other folks. So there is that dimension to it, though. As Jasmine kind of mentioned, there are ways to sort of pair people with folks that are kind of bilingual or dual language that are definitely worth exploring. I think what I kind of learned during the report is that it's sort of like both sides of the equation, right? Sometimes there's sort of English as a requirement for the kind of the work itself. Sometimes it's a requirement for the training, and sometimes the reason for that is the people who are on hand to conduct the training themselves are not able to sort of speak the language that are spoken in the class, or you have a class where you have people who speak Creole and Ukrainian and Arabic, and so even if an instructor speaks one of those languages, you can't really do the class. You have to kind of do the class in a neutral language, which often will sort of just be default English. So there's that complication as well. But it's definitely a sort of a thing that can be done in some context.
Okay, I have another question, maybe to Rishi and a little bit to Yasmin, that has come up, which is, you mentioned, Rishi, this lack of coordination. So the New York City is trying to respond, and New York State is trying to respond, but busloads of people arrive with no coordination, with no warning, and clearly, there are states in the US that are having to deal with great numbers. It just seems sort of it leaves people incredulous that there couldn't be better coordination, that there couldn't be phone calls between Texas and New York City or Arizona and New York City to coordinate this. So I want to get your view on whether that's improving at all. And maybe for Yasmin, there's a similar situation, not with Ukrainians, but people coming through Italy and Greece, and then wanting to go to other places. And I just wondered if the EU has figured this out in a better way, or is this kind of politicized lack of talking to each other is universal? So Rishi first.
Sure. Yeah. Thanks for that question. It's an important one because that coordination could really help government. It can help CBOs, help people sort of get onto where they need to go and get the services they need, at least initially. I think you're right that it is outrageous that there has been no coordination, particularly from when buses have been coming from places like Texas and Arizona. But I do want to acknowledge that what we've seen community-based organizations, not just in New York City, but across other places, Texas, Tennessee, New York, really step up to play a role in that coordination. And it's not perfect, but it has really helped. I've been at the Port Authority bus terminal when buses have come in, and I've seen the state that some people are arriving, and sometimes that was with no food, no water for days, and that's just unacceptable, and in some cases preventable. The last thing I just want to say on this is that the way that people are coming is quite diverse. Some people are coming on buses from Texas. Others are coming from other jurisdictions where they were briefly, whether alone or with family or friends, and choosing to come. So there's not really one way, which does make the response more complicated. There's not really one way that people are arriving. But certainly a relatively simple solution would be to have a heads up from particularly the governments of southern jurisdictions, so that we could be prepared.
Great, thanks. I don't know, Yasmin, if you want to add anything to that. Or
absolutely. I think in the EU context, it's really the EU institutions and the European Commission that play a central role. They gather data, they have constant mapping of trends, and they share the latest data in a weekly blue paper. And they even use forecasting methods to predict trends in the future. So there's very clear coordination here. And I think what is key here is to really invest in these partnerships and collaboration also outside of times of emergency and crisis, to make sure that our trusted relationships among different stakeholders to work together in a fixed platform once such a problem arises.
Great, thanks. Dean, perhaps we've come...
Yeah, I think we've come to the end of our question and answer segment, because I'll tell you, this has been a very well-received panel. It feels like we chose a topic that is very timely. Maybe we'll have a follow-up with you guys. You stimulated a lot of questions on the question panel. But I think at this point, we have to close the question session, and I would like to hand the reins over to my dear Professor Kathleen Cravero to give some closing remarks. And thank you all heartily for participating in my Dean's Grand Rounds. I truly appreciate your participation, and thank you for your wisdom and for your openness. You made this really a terrific, terrific session. Thank you so much. Kathleen?
Yeah, thank you very much, Dean. I'm just going to highlight a couple of the things that came up during this session, this webinar, that I think would be important for people to remember, or just some key messages. One is migration can offer opportunities. So crisis versus opportunity, the choice is ours. Secondly is New York City, New York State, or any jurisdiction can respond well, but if there's a lack of coordination, that good response is going to be consistently and continually undermined. The third is raw numbers versus good policy. And I think this came up clearly. There are millions of people coming into Europe right now, into different countries, being handled in a certain way. So should we be focusing on the raw numbers, or should we be focusing on the policy response to those numbers? And fourthly, there are very specific measures. There are examples of what works, what Venus described, the examples that Yasmin gave, so many: coaching, flexibility, wraparound services, credentialing. There is a lot to build on, that rather than just stand back and say it's a crisis. And I think lastly, I just say two words or two phrases. The first is innovation. Let's think out of the box. Let's look at the shortage we have, the skills of the people coming in, and try to think innovatively to match them. And perhaps I'll just close with something that Venus said, which is maybe we should all lead with our hearts in this a little bit more. Maybe lean in with our hearts and with some determination to make this work, and to welcome new people as they come, and to really get a win-win situation, because it's so obvious there is one. So with that, I just really like to thank again, to reiterate the Dean's thanks, the thanks of the Pandemic Response Institute, the Center for Immigrant, Refugee, and Global Health, and on behalf of the entire community of the City University of New York Graduate School of Public Health and Health Policy. We hope this is the beginning of a conversation, because we really want to make it a mission at the center and at the CUNY Graduate School to see migration as an opportunity through good policy, good work, and right intentions. So
Thank you so much, Kathleen. Thank you so very much. Thank you, panelists. Again, our young leaders, Ainsley, Cameron, I don't see your face on the screen, but I heartily thank you. Danielle, thank you for everything you did to make this work. And thank you, Paolo, for your administrative support. With that, have a wonderful weekend, and thank you again.